Welcome to Birkdale Dental. I'm Dr. Michael Wing, and today I'm going to talk about flossing. Flossing seems to be a common question that I hear from my patients as to whether or not it's an important thing to do. And the emphatic answer is yes. Recently there was a news blip that talked about flossing and its ineffectiveness. And I've been practicing dentistry for 24 years, and I gotta tell you that's absolutely false. In fact, you can simplify your experience so easily. And here's a great example on how you can do that. Just go home and stop brushing your teeth for a week. And after you stop brushing your teeth for a week, assess your oral health and see if you still have friends. And the presence of bad breath, bleeding, swelling in your gums, dull aching pain, that's what you're going to experience when you stop brushing. Well, flossing is equally important. In fact, in some ways, it's more important, because 80% of the bacteria that's in your mouth is harbored in pockets around your teeth. And the only tool or instrument that's going to remove that bacteria is the use of dental floss. So today I'm going to talk about the proper technique and the use of dental floss. I've even been on YouTube and watched other dentists demonstrate proper flossing. But one of the things that seems to be missed is the concept of how bacteria is involved. And bacteria is really important. Sometimes we have good bacteria in our mouths and sometimes we have bad bacteria. Well, it's the bad bacteria that we want to get rid of. And I'm going to talk about that today with our flossing technique. So the first thing you want to do is you want to choose a floss that goes between your teeth easily. Okay? And I don't typically talk about brands, but in this particular instance, I'm going to say that Glide is a really excellent floss. It seems to slip between the contacts very well. And oftentimes I'll get patients come in and say, I can't get my hands in my mouth, or I can't get the floss between my teeth, and they're using waxed, taped dental floss that's really bulky and it's difficult to get between your teeth. So switch to something like Glide. And the next thing I want to talk about is you want to get a good amount of floss, about 2 feet to be exact, when you're flossing your teeth. And the reason I want you to get 2 feet of floss is that I don't want you to carry contaminated floss from one pocket to the next. It's almost like brushing your teeth and not rinsing your toothbrush off in between brushing, because you're carrying blood and bacteria from one section of floss into the next pocket. So it's really important that you wrap the floss around your teeth, create a C shape around the axis of the tooth, and sweep the pocket gently. I don't want you lacerating your gums or slapping the papilla. I just want you to drop into the pocket gently, and with just a few grams of force, you sweep the pocket. And when you go into a contact, you're going to wrap around the tooth behind and the tooth in front of that contact. And don't forget to floss the back of your teeth too. The last molar in your mouth is important too. There's oftentimes pockets but behind your second molar from where you had wisdom teeth removed that collect bacteria too, so start back there. So I'm just going to simply demonstrate how I floss my teeth, and I'm going to step up to the camera here so you can see it. And as you see, I'm going to advance new floss to the next contact, and again advance new floss to the next contact. And now I'm going to show you between my 2 front teeth, wrapping that axial side of the tooth. And that's pretty much it. You're going to work between each contact and go around the entire mouth, getting rid of bacteria that causes periodontal disease. The act of flossing reduces your chance of periodontal disease by 80%. And just so you know, the definition of periodontal disease is the loss of bone and attachment around your teeth. And once you lose bone and attachment, you can't put it back. And that's how we end up with early tooth loss. 80% of us have periodontal disease, and the only differences in the population is that some of us control the periodontal disease and some of us don't. The people that control the periodontal disease keep their teeth for the rest of their life, and the people that don't control the periodontal disease end up with early tooth loss. And that's what we want you to avoid. They end up with situations like this, where we have to put dentures in and use mini implants. And we're good at doing that, but I'd like to save you the cost and expense of doing that. So just so you know, the definition of periodontal disease is the loss of bone around your teeth, the loss of attachment. And once you lose bone and attachment, you can't put it back. And so essentially the only tool that's going to effectively keep you from getting periodontal disease is the use of dental floss. Thank you for watching this video, and watch out for more. This is Dr. Wing with Birkdale Dental.